Hello, everyone. My name is Andrea Handy, and I'm a learning and development consultant here at Cal Poly Pomona. This year, Cal Poly is participating in the 2021 Heart and Stroke Walk on April 9th with the American Heart Association. To show our support and to promote awareness, I've invited two of my friends to share their experience with you. In June of 2020, Amanda and Ryan Londo experienced the unthinkable. And here they are to share their story.
Well, the morning of June 11th, 2020, Ryan woke up about 5:30 in the morning with an extreme headache, kind of like a migraine in a sense. Um, Very dehydrated, so he was really thirsty. Um, a little wobbly, not balanced. So he was able to go take some Tylenol, get something to drink, and then come back to bed. But the pain in his head just kept, getting worse and worse. Then he started vomiting. So whatever he ate the night before and then whatever he drank the morning of, it was just all coming out. He was vomiting for quite some time until, his body, what seemed like he was going into shock, getting the cold sweats, skin was turning pale, very disoriented, just kind of complete going into shock. So then once that was happening, we had to rush him to the emergency room, and then from there it just went downhill.
And Brian, do you remember anything from this
I
point?
don't remember nothing.
You don't remember anything. So during all of this, of course, it was during the pandemic. So how was that like in just not being able to be with Ryan during this time at the hospital?
It was the worst experience during a pandemic, not being able to be with your husband and just have that communication with doctors and nurses, and to find out what's going on, what's going to happen. Like, I had to drop my husband off, and they told me they would call me in within the hour, and that's just something you don't hear of. Those are, you don't want to hear those words. You want to be there in the hospital finding out what's going on. So I took it upon myself to call the hospital 50 minutes after I dropped him off. And that's when I found out that they had already done life-saving procedures.
And so what is it that they had told you when Ryan was admitted to the hospital?
They told me that the nerve endings in the brain had burst. His blood pressure had reached 280 over 150 something. It was very high. Not too much information, of course, yet. They just said they had already performed life-saving procedures. It was just that it happened just so fast. And then a couple of hours after, that's when I was able to talk to somebody about what procedure was done and how they had to do it and where it was placed. And, he was in an induced coma for about 2.5 weeks. They put not a shunt. I forgot the term for it, but he's got a little war mark right here. So they had to let the brain drain out. So fortunately for Ryan, he doesn't remember anything. I wasn't able to be there to see all these things going on, which was, of course, again, the worst experience during a pandemic.
So what was it that actually Ryan was experiencing? you said his nerve endings burst.
Mm-hmm.
Was that on one side or both sides?
It was in the center of the brain. So what they call it an intracranial hemorrhage. So it starts from the center of the brain, leading into the left side. And in Ryan's case, it was so severe that it was already leading into the right side. And apparently, once it leads into the right side, it causes death. In most cases, it's death. In his case, he was very lucky to have survived. We were able to get him to the emergency in time, to save his life.
And how long was Ryan in the hospital?
Well, total, Ryan was in the hospital for 92 days. He was at Arcadia Methodist for 4 weeks. And then he was transferred to, I can't think of the other hospital right now.
Is it Whittier?
Oh, yeah, Barlow and Whittier, to wean him off of, what's it called again?
Tracheotomy.
The tracheotomy. Yeah, he spent about a good 4 weeks there. And then he went to Casa Colina where they did, the therapy. He was already off the trach, kind of walking. He was talking. He was eating. He still had a G-tube there, which was a feeding tube.
Really?
Mm-hmm. Yeah, so there they were able to help him to get up, walk, talk, read, write, especially eat. Food was terrible.
Yeah, bad.
So, Ryan, how far back do you remember?
I remember Casa Cleana, but that's all I remember. I don't remember the other two hospitals.
And what do you do at Casa Colina?
Had therapy, or when I was at the hospital, there was staff there, and I had to go to classes. I remember laying around a lot.
So, how has the recovery been for you, or for both of you?
Hard.
Tough. Yeah,
Yeah.
it's been tough. He has his long-term memory is fine. Short-term memory he struggles with. It's the constant reminders of when to take your pills, or did you drink water today? Did you do your worksheets today? Little things like that, or if he does things during the day, I'll ask him about how his day was later on in the evening, and sometimes he'll forget what he did that day. But I mean, it's something he's working on in therapy. They're doing a pretty good job.
Have you seen a lot of progress since he's been home?
He doesn't see it, but I do. His speech therapist, his occupational therapist, they see a big difference.
I mean, it was like when something's wrong, and like now I'll notice it. Before I didn't do that.
That must be difficult, though.
Yeah, it's hard.
But that's progress in itself, though, isn't it?
Hell yeah, yeah. I mean, that's what I'm told.
So, what would you say for someone who might be in recovery right now, to their family or to them themselves? Like, what advice would you give them?
Would I? God, I don't know.
Just be patient.
Yeah, it's a long road.
It's not easy. The whole process is not easy at all on anybody, but it's something that you as a family can work through. If you have that support system, you'll get through anything.
Yeah.
After a few months of Ryan being in the hospital, Amanda and her family learned that Ryan had coded shortly after being dropped off. As she learned this information, Ryan was still working very hard to come home to his family. It's a miracle that Ryan is alive and with us today. After extensive hours of physical therapy and love from his family and friends, he's relearned how to walk, how to talk, and of course, just have a good time. One thing that has never left him was his humor. His progress has been difficult but amazing to witness. And I hope that you hear Amanda and Ryan's story and receive it as a message of love, hope, resilience, and inspiration. And if you see the warning signs, make sure to get help. If you'd like to show your support, please register on the link below. And we hope to see you at the 2021 Heart and Stroke Walk digital experience. Thank you.